In AccuDent, I am going to show you the different tabs that we have here: medical, dental, vitals, and allergies. So if you open medical, you will see a certain number of questions. Was the weight of the patient? Answer by the weight, yes. And the weight will be 65 kg. I have sensitivity to soy protein, to cow milk. All this is coming from NABID. We did not change anything. We had to implement that to be compliant with NABID. But what you can do, you can add whatever you want. For example, about cholesterol, about to signal something, allergy, not feeling good with this and this, or you can signal heart disease or not. So when we have one yes like this, it will come by default on the patient's chart. Let me show you. I save. This is saved. We go back now to the patient list, patient chart. And here now we have the weight which is coming here. You see, you have a banner, and this banner will show you all the allergy, the contraindication, and all what you need to do. You don't need to open anything. The medical yes will come here along this banner. Let's go to dental. In dental, and this is again mandatory for NABID, you have a kind of request. The problem. What is the dental problem? Dental problem based on what the patient will answer. Priority request. Yes, there is a priority request. At which date? At this date, today. And what is the details of that? You go to comment and you say pain to call 116. Okay, so I have something like this, and I will save first. I save. All these questionnaire in some cases need a digital signature. So you go to digital signature, you have the request, you have that, and you have the signature. This is an old one. We can delete the signature and we can make a new one. Let's say a new one is done. We save in the history with the signature, and we save the signature first, save the signature, and save in the history. We have two levels to save at this time. Save in the history now, and this will be saved in the history. If you want to print it to give to the patient what she's been doing, so we can do it also in this way. So I go to the patient chart again, and we have the dental. Following the tracking of the dental here, you see that the problem is active, but you made, let's say, a root canal, and now the treatment resolved the problem. So we say that it is resolved, and we put the date where we've been able to resolve the problem with the root canal treatment. So now we can save this, and this is saved in the history of what has been done on this patient based on the initial problem, mandatory for NABID. The vitals. This is also mandatory from NABID. You have a certain number of vitals. Of course, this is more done with the hospitals than in a dental clinic. But if you want, you can give the blood pressure, diastolic, systolic, respiration rate, and all these things. Most of the patients, we will never do that in a dental clinic, but if it's needed, we can do it. And allergies, once again, the list of allergies is mandatory for NABID. So we just copy and paste that. Allergy to warfarin, allergy to phenoltrin, allergies to malathion. So all these things, most of the dental clinic will never ask about that. But we need to be aware about the allergy. So we've been adding allergy, yes, to what? Something which are interested, the penicillin, and this will come when we save this. This will come at the bottom of the patient chart. So we go to chart, and this is updated now. The chart is updated. And now we have all what has been done in medical, dental, vitals, and allergy. You see the weight, you see the allergy to penicillin, you see the priority request on call, which is that. So we know what's the tracking and we know what's the history. But let's say that you need to change something. You go to utilities, you go to medical questionnaire, and the medical questionnaire will give you access to all the list of questions you are asking to the patient. Some of these you cannot remove them because they are mandatory by NABID, and some of them you can add. So let's say we've been adding the general allergy. I am going to edit this. So in question allergy, the type is allergy. It can be vital, dental, or medical. So you select what you want to do and you select the name that you want to give to that. So you go back to medical allergy and you have now allergies, you have vitals, you have medical, and you have dental. All this is the list of what you need to get as questions, and you put that in alphabetic order. It's easy for you to find where are the vitals, for example. So this is in utilities medical questionnaire. And when you go back to the patient's file, so in the patient's file, you will get all what you need to work in a good way. And this is on this patient. I opened the patient. I edited something in medical, dental, vitals, and this is coming here. And if I want to change, I go to utilities. I think you have all the questions to solve the problems of the questioners. I thank you for your attention.